cranial nerve. In some cases, you have to know the difference between an upper motor neuron and a lower motor neuron lesion. Okay? So you have to know pathways for some. But the basics is you certainly have to be able to name all 12 nerves and spell them correctly. Okay? And then know the functions. For example, if I say cranial nerve number 3, can you tell me the functions of cranial nerve number 3? Alex, if I ask you cranial nerve 3, give me one function. Okay, now, if I ask you the function of a cranial nerve, moving the eye isn't enough. Okay? That's what a layperson would say. And I know that first slide on the PowerPoint says sees, smells, moves the eye, and that's great for introduction. But at this point, what I want to know is what muscles does it innervate? All right, so it innervates the pupillary constrictor muscles and it innervates the ciliary muscles. With respect to the former, the pupillary constrictor muscles, what type of activities does that bring about? Well, for the former, that would be pupillary constriction. What does that do then? It causes the pupils to constrict, and what do we call that? What's the term we use for pupillary constriction?
Accommodation. No.
Meiosis.
Meiosis.
Now,
and then dilation.
when the ciliary muscles contract, what activity does that bring about?
Dilation.
Accommodation.
Oh, the ciliary.
So that's thickening of the lens for near vision. There will be some definition. So if I had a definition for accommodation, it would be thickening of the lens for near vision. Okay? So, accommodation, meiosis, what are some of the other functions of 3?
Oh, I'm sorry.
Okay, opens the eye. All right, so what, again, be more specific. So what does it innervate then? What's the name of that muscle? Levator palpebrae superioris. That's what lifts the upper eyelid. Now, let's come back to moving the eye. What extrinsic eye muscles does 3 provide innervation to? Inferior, right. So superior rectus, inferior rectus, medial rectus, and inferior oblique. That's correct. Now, name 3 deficits. Name 3 type of symptoms one would develop from a third nerve palsy. Ptosis would be one. What else? Mydriasis would be correct. Now, a symptom would really be a subjective complaint. It would be, no, that would be 7. But a symptom, instead of mydriasis, isn't really a symptom. Symptom is a subjective complaint. So if your lid is drooping, that's a symptom. But the symptom that would go along with mydriasis would be photophobia. In other words, if your pupil is dilated and can't constrict to light, you're going to become sensitive to light. You're going to develop photophobia. Okay. And then in terms of the inability to perform accommodation, it's going to lead to blurred vision. Particularly with near focus. And you develop double vision. What do we call that? Diplopia. Diplopia is seeing double. Diplopia. So you're responsible for knowing not only the function of that particular cranial nerve, but what happens if that nerve is knocked out? Right, it opens it, so if you knock it out, you get ptosis. It doesn't close, but you get ptosis. The lid droops. Right. different functions of the seventh nerve. Lacrimate,
Oh, salivate.
salivate,
Defecation.
closes the eye. Now, when you say closes the eye, what muscle are you referring to? Because we talked about two different. It's not the zygomaticus. The muscle that closes the eye is what? Orbicularis what? Oculi. So the two muscles, if I ask in a short answer, in fact, this was last semester, I think this was on my wife does a lot of fill in the blank. And so you had to name the two muscles innervated by 7. So one was orbicularis oculi, the other one was zygomaticus major. It helps you smile. Lift the corners of your mouth. So what salivary glands does 7 innervate? So they're doing something like what innervates the parotid? Right, what is that called? Glossopharyngeal nerve. Okay. What part of the tongue does 7 innervate?
Is it 2/3?
Anterior 2/3. Anterior 2/3. What innervates the posterior third?
Is it?
Hypoglossal.
No.
Is it?
Glossopharyngeal.
That's 9.
That's 9.
Yeah.
Yeah.
The 12 is just yeah.
Now, what is the name of the organ of hearing
Organ.
innervated by the vestibular nerve?
Cochlea.
Cochlear nerve. The organ of hearing innervated by the cochlear nerve. Be specific. Go ahead.
What's the question?
Cochlea?
Well, the cochlea is the entire structure.
Oh. Is
Okay,
it the organ of
the organ of Corti.
Corti?
Right. So, and they call it the spiral organ or the organ of Corti. Okay, remember that has what types of neurons?
Is it bipolar?
Bipolar.
Is it sensory?
Special sensation. Okay, so if I asked which nerves carry bipolar neurons, what would it be?
Olfactory.
Olfactory,
Optic.
optics,
And the vestibular
and
cochlea.
cochlear.
Olfactory, optic, and vestibular.
Kimberly, we mentioned innovation of the product. Give me another function of 9.
Off today, sorry.
Okay. It's important, and I'm going to say this for everyone. I'm not referring to Kimberly now. But when you study AFP, you have to study all along. If you're starting to study cranial nerves now, you are way, way, way behind 8 ball. If you do poorly, don't blame anybody but you. Okay, take responsibility. If you do poorly on the test, where does that finger move? It should be pointing to you. Don't point to anyone else. Okay, you've had a long time to study for this test. You know from the get-go, you have to know your cranial nerves. Not only for this test, but if you're doing nursing, when you do physical assessment, 2nd semester, you know, when you do pathophysiology, you have to know because you'll have neural problems. So there's no getting around cranial nerves. You have to know the autonomics when you do pharmacology. So this is stuff you need to know. Don't wait till the last minute. You will never learn it in the last minute. All right. Now, if somebody has a left brainstem stroke that affects the hypoglossal nucleus, in which direction is the tongue going to deviate? If it affects the left brainstem, with brainstem lesions, the tongue deviates to the side of the lesion. So it deviates toward the left. If I ask you to draw up the pathway that supports your thinking, you're able to do it. Okay. How do you draw up the pathway? You can do this. You say, okay, this is the brain. Okay, this is the tongue. let's do this, let's put the brainstem in here. And this is a real thumb. Okay. So where would be the hypoglossal nucleus, and what part of the brainstem?
Posterior medulla.
It would be in the medulla. It'd be in the medulla. So if it's left, this is right, this is left. It's always as if the patient is facing you. So the 12th cranial nerve nucleus is going to be somewhere down here. Okay? It's going to house the cell bodies, the lower motor neurons. So this is a representative cell body. Here's its axon, which is part of the 12th nerve. It's innervating the left side of the tongue. It's going to push the tongue toward the opposite side. Okay? Its upper motor neuron innervation is contralateral. Where? HAL. So it's going to be somewhere down here. Okay. Crossover like this. Now, if we have a lower motor neuron lesion, we're knocking out the distal part of the pathway, which moves the tongue to the opposite side. So as a result of unopposed contralateral innervation, the tongue is going to move toward the side of the lesion. Because the right 12th nerve is now unopposed. And the right 12th nerve is going to push it to the left. So at the level of the brainstem, if you have a lesion involving the 12th nerve, the tongue deviates to the side of the lesion. Okay. And so in a test, it might not only, for the short answers, it might not only ask you for a quick answer, like what side does it move to, right or left, you could guess the answer, but you have to be able to support it. You have to be able to draw a pathway. Okay? In other words, you have to demonstrate understanding, that's all. Same thing with visual fields. If I tell you someone has a lesion of the right optic tract, what type of visual field defect would they have? So yeah, if it's the left optic tract, they're going to have a right homonymous hemianopsia. And you should be able to draw that and explain why. Okay. What's that? They do what? They bump one of the things on the right, right? If they have a right homonymous hemianopsia, their right visual fields will be gone, and so they're not going to see things on their right. They're going to tend to bump into things on that side. Okay. All right. What are the functions of cranial nerve number 5?
Different parts.
Right, so it'd be 1, 2, and 3. What function is in common to all 3 of those? Well, sensory. Motor is unique only to the mandibular division, but all other divisions, 1, 2, and 3, ophthalmic, maxillary, mandibular, all feel the face.
Right.
Just different parts of the face. Whereas what's unique to the mandibular division is that it also innervates. Name 2 muscles that it innervates. Masseter and temporalis.
Yeah.
Masseter and temporalis. Okay. What is the name of the opening through which 9, 10, and 11 leave the cranial cavity? The jugular foramen. Right. Now, what is the name of the opening through which 7 leaves the cranial cavity? Stylomastoid foramen. Okay. And 7 passes through which structure? What is
Yeah.
it?
Internal acoustic layer.
No, well, that's an opening. It passes through an opening, but which structure does 7 pass through?
Stylomastoid foramen.
What
Oh,
important
the
structure? Parotid gland.
You said 7 passes.
Right. I showed you an image of a cadaver where you can see the nerve passing through and subdividing within the parotid. Okay? Anatomy is visual. You know, when you see that image, you have to retain that image. What cranial nerves move the vocal cords? 10 is the primary cranial nerve involved in speech, with some support from 11. Remember, 9, 10, and 11 all assist with innervation of the pharyngeal muscles, but 9 and 10 are the two most important in that regard. 10 is primarily involved in speech, 11 helps a little bit.
Doesn't 11 help with the sharp of the shoulder?
Well, 11, the way we differentiate 11 from the other two is by its innervation of what two muscles? No,
Sternocleidomastoid.
sternocleidomastoid, that's it, and trapezius.
It's okay.
So trapezius and sternocleidomastoid.
It's not good.
What type of, from a functional standpoint, what type of fibers are those that provide innervation to the sternocleidomastoid? Parasympathetic? Well, parasympathetic is autonomic.
Somatic.
Somatic efferent.
Somatic motor. Somatic motor. All right, the corneal reflex. Brainstem reflex. What cranial nerves does it test? That's the pupillary light reflex.
Wait, you said the what?
Corneal reflex.
Is that the V1 with the cotton ball?
Right.
Yeah.
So
Yeah,
V1.
because it has to blink when you touch it.
So
Yeah.
V1 and what else?
There's another
3.
Now, so the response to touching the cornea is for the eyes to blink. So what nerve brings about closure of the eyes?
Oh,
3.
7. So it tests V1, ophthalmic division of 5 and 7. Now, let's talk about the bladder. The parasympathetic motor fibers that provide innervation to the bladder, where their preganglionic cell bodies located.
Sacrum.
The sacral part of the spine. What part of the sacrum?
S2 to S4.
Yes, dude, that's 4.
Got that shit.
The intestines, whether their preganglionic nerve cell bodies originate.
The brainstem.
What?
The brainstem.
Where? Rule of force.
Is it
Medulla.
Medulla.
Rule of force.
First.
Oh.
Let's suppose somebody has a herniated disc, which is compressing the ventral root of C7. Does that affect, which of the following does it affect? A, somatic motor fibers. B, parasympathetic motor fibers. C, sympathetic motor fibers. Or D, all of the above.
Somatic.
That would be just A, somatic. Why wouldn't it be parasympathetic or sympathetic? Why would it be sympathetic if you compress the ventral root? Do not sympathetic motor fibers leave the spinal cord through the ventral root,
Not through the cervical.
but not at the cervical level. Sympathetic doesn't begin to T1. So T1 through L2. You'll have to be able to connect the dots. Piece the questions together. Now, for organs located below the diaphragm that receive innervation from the sympathetic nervous system. Where does the synapse occur? Prevertebral ganglia. What's the name of the three prevertebral ganglia?
Celiac.
Celiac,
Superior mesenteric. Mesenteric.
mesenteric ganglia, and inferior mesenteric ganglia. Okay. What about the stomach? Where does the synapse occur? The sympathetic nervous system. Yeah, it'd be the same thing. It would be, if it's below the diaphragm, it's going to be the celiac, superior mesenteric, inferior mesenteric ganglia.
We don't have to know which one its synapse is at.
No.
The three. Okay.
We said that the radial smooth muscle of the eye primarily receives sympathetic innervation. Within which ganglia does the synapse occur?
Sympathetic trunk.
Sympathetic trunk. Right, the radial smooth muscle is above the diaphragm. So it receives sympathetic innervation. It's either going to be the sympathetic trunk or the prevertebral ganglia. Well, because it's above the diaphragm, it's going to be sympathetic trunk. The white ramus carries which of the following fibers? A, somatic motor. B, parasympathetic motor. C, sympathetic motor. Or D, B, and C? It's only sympathetic motor. What's that? That's right. What is the primary hormone released from the adrenal medulla?
Epinephrine.
What is it?
Epinephrine.
Well, catecholamine is a class of molecule. Y'all have taken some chemistry? A catecholamine, this is kind of general chemistry. There's your benzene group. A catechol is just the benzene with no H. Okay. Catecholamine, it means that's going to have a nitrogen containing group somewhere else too. So that's what a catecholamine is. So epinephrine and norepinephrine are catecholamines, meaning the basic structure looks like this. Okay, so the adrenal medulla produces both epinephrine and norepinephrine, but in response to sympathetic stimulation, it releases mostly epinephrine, to a lesser extent, 80% epinephrine, 20% norepinephrine. What type of receptors do epinephrine and norepinephrine bind to? Adrenergic. What are the two subtypes of adrenergic receptors? Alpha and beta. Now, what about organs innervated by the parasympathetic nervous system? What type of receptors do they have? Muscarinic, yes. Yes. Organs that are innervated by the sympathetic nervous system, what type of receptors? Right? Right. But in terms of the sympathetic, what type of receptors? Adrenergic. The end organ, if it receives sympathetic innervation, is going to have adrenergic receptors. What's the exception? They have muscarinic. They have muscarinic. So make sure you can draw that one slide. That one slide. All postganglionic nerve cell bodies have what type of receptors? N, nicotinic N. Whereas skeletal muscle fibers have what type of receptors?
Nicotinic M.
Nicotinic M. What is the name of that medical condition? It's an autoimmune disease in which we produce antibodies against nicotinic M receptors.
What is it?
talked about Jackie O. Her second husband had this condition.
I was sleepy.
Well, that was the name of the
The
dwarf.
dwarf.
Something
Okay,
gravis.
so myasthenia gravis.
Oh yeah.
Myasthenia gravis. What do we call that subcellular structure lined by a membrane that houses the neurotransmitter?
Synaptic vessel.
Synaptic vesicles. Synaptic vesicles. Okay? We said that when a nerve impulse reaches the axon terminal, it opens up voltage-gated calcium channels, allowing calcium into the axon terminal, and that triggers fusion of the synaptic vesicle with the presynaptic membrane. So the neurotransmitter is released. What do we call the white of the eye?
Sclerosis.
What are the three parts of the uvea? That's correct. That's correct. Now, what type of muscle does the ciliary body contain? Right. And it's innervated by what? The ciliary muscle is innervated by what cranial nerve? Three. Okay. What do we call a condition where the lens becomes clouded?
Cataracts.
All right. Which structure produces aqueous humor?
Enter.
Cornea.
Is it the chamber?
The cornea.
The ciliary body. Remember, it's filtered from capillaries within the ciliary processes and released into the posterior chamber. Who wants to volunteer? Emily, I appreciate it.
I know, that's why I always do it low, because it doesn't matter if I
Right, I want to see somebody leave their comfort zone. Sometimes the people who need to volunteer are going to be those least likely to volunteer. So, thank you for volunteering. Who else wants to volunteer?
Oh, so wait, I'm rejected?
I just want to see who would be willing to volunteer, that's all.
Give it to me.
You don't need it. Shut up.
It's okay.
That's
we
why I
rejected,
don't.
Chris. We rejected.
If you're unwilling to volunteer, okay? Ready, you want to volunteer?
Yeah.
Okay. Only you know who is really hesitant to volunteer, raise your hand. If you're hesitant to volunteer, if you're really afraid of volunteering,
Oh, well, no, I'm not afraid of volunteering.
okay, then good. Let's bring you up then.
Well, I raised my hand. And you
Well, come on up. Come on up.
That's
All
so
right.
strong.
Thank you.
Yay.
Okay. I want you to list when light enters the eye.
Yeah.
I want you to list in order
Oh, that's not.
the structures through which it passes.
Okay.
Okay. So light is coming into the eye. I want you to list the structures through which that light passes. Start with number one.
Pupil.
And just go ahead and do it. We're not going to give you any feedback. Just go ahead and list the
I
five.
guess the people.
Or the four. Or the three.
You
Maybe
just-
just one.
You forget about the iris.
Doesn't go from
Iris, humors after. And then the neural layer.
And then, like, your neural layer is the last thing.
Well, it has
Keep
to
on
be through
going.
the-
Whatever light
The
passes
last
through,
one I have
just
is the neural layer.
go ahead and put it down.
It absorbs some of it. That was
All right, well, thank you. Okay. Sarah, you volunteered. I appreciate that. Let's fix this. Let's fix that. Okay, that's all right. You could just walk through it. But does light pass through sclera?
No.
No,
Why not?
because that's the white of the eye.
It's the white of the eye. It's not transparent. Okay, so the only part that of the fibrous tunic that's going to allow light in is what? Yeah. Cornea. Right. Now, after light passes through the cornea, what does it pass through next? What substance or structure? Let's put it down.
Go with your instincts.
What?
I said go with your instinct.
Yeah.
'Cause she wants to go right.
All right, keep going. All right. All right.
What, Chris?
Your iris separates your anterior and posterior chamber, right?
I'm thinking myself.
Yeah.
I
Wait.
don't know.
The segments is between the lens.
Okay, Christine, come fix this. I just put a line to the wrong one and put the correct thing in its place. That's wrong.
Did the aqua?
No, I want you to write. Yeah, you can include fluid.
It's the
You have the anterior and posterior, and then, yeah, the iris separates that. Then you
And
have,
the lens separates your segments.
yeah. And then what is the Oreo signature? Or the core of the retina. It's you wave
Okay.
of the retina, right?
So,
You wave of
is this correct?
no.
All right,
No.
let's put the part that's correct.
Cornea.
Okay. Brittany, fix this mess.
You said it's a wave of the
Yes.
retina.
Oh, the neural layer.
Oh, no. Oops.
I was like, what do you say?
Yeah.
You said there's something.
Neural layer. You've got your neural layer and your pigmented layers.
Yeah. I keep getting confused with that.
Yes, that's it.
Go Brittany.
Oh.
You just
Okay. What do we call
So-
that component of
Does it
the eye?
pass through the pupil?
Yes,
Does it pass through the pupil?
it does pass through a pupil, but the pupil is just is an opening
It's right.
within the iris.
So it doesn't really have any.
So if you want to put, for instance,
Aqueous humor.
aqueous humor, pupil, aqueous humor again, and then lens, I'd be okay with that.
But it's kind of like you don't
Yeah.
have to.
It's,
don't
you know,
Yeah.
So I
That's
can
the
have
way.
it.
that thin
Fine.
space is filled with aqueous humor.
Okay.
What do we call the component of the eye located between the lens and the cornea?
The lens and the what?
Between the lens and the cornea.
Is that the middle one?
Anterior segment.
Oh.
Anterior segment. Now, remember, the anterior segment is then subdivided into
To the chamber.
anterior and
Yes.
posterior chambers. Now, what is the name of the structure through which the aqueous humor is drained?
Venus.
Sclera
Serial.
venous sinus.
Yeah, another name for that is the
Canal of Schlemm.
canal of Schlemm.
Oh, yeah. Okay.
Now, the canal of Schlemm is located at the junction between the cornea and the sclera. What is that junction called?
Limbus.
The limbus. The limbus. Okay. If I were to draw a picture of the retina,
Canal of Schlemm. Canal of Schlemm.
In fact, when we teach clinical patho to the pre-meds, everyone gets an ophthalmoscope, and you have to look at the retina. So you practice the whole semester looking at other people's retinas. But you'll see a yellow structure here, and coming through that yellow structure, you see some blood vessels,
Cornea meets the sclera.
like this.
Just like that.
And you'll see a little area here that's free of blood vessels.
Yeah, it's like where the color of your eyes is the white of your eye.
Okay. What is this yellow structure called through which the blood vessels run and enter onto the retinal surface? Optic disc. And lateral to it, what do you call this little area through which there are no blood vessels? Macula lutea. Macula lutea. Now, name 3 different cell types located within the neural layer of the retina. Photoreceptors is one,
Bipolar.
although the types of photoreceptors, but some types of photoreceptors
Bipolar
Cells.
Ganglionic.
and ganglionic cells. Which of those 3 contribute to the optic nerve?
Ganglionic.
Ganglionic cells, their axons
Make it up.
make up the optic nerve. All right. What do you call a condition where the intraocular pressure is excessively high? Glaucoma. Glaucoma. Okay. What are the 3 components of the cochlear? Say it again. Well, those are the ossicles in the middle ear. I'm talking about now the inner ear. The cochlear is part of the inner ear.
The scala,
Scala,
vestibulus,
tympani,
tympani, scala,
vestibuli,
media, scala.
and then the cochlear duct.
That.
In other words,
But the words are just not happening.
Blur, blur, blur,
now,
blur.
what's the name of the fluid that's contained within the cochlear duct?
That's wax.
Endolymph.
Endolymph.
Oh, I knew it was one of them.
What
Endolymph.
was the 3?
What?
What was the 3?
I think I'd know.
What part of the labyrinth is responsible for static equilibrium?
The best.
The vestibule. What component of the temporal bone is contiguous with the middle ear cavity? Well, the middle ear cavity is in the petrous portion, but what other component is contiguous with that middle ear cavity? Well, that's a
But that's not a part of the
channel.
temple bone. The internal acoustic
Yeah.
Oh, the mastoid.
mastoid process. Mastoid process is contiguous. It's got air cells that are contiguous with the middle ear cavity. What are the names of the 3 ossicles? Malleus, incus, and which bone? Which of those 3 bones? That's correct. Which of those 3 bones interacts with the oval window?
That's the safety.
Stapes.
Because it doesn't damage.
Which of those 3 bones can you see when you use the otoscope to look at the tympanic membrane? Malleus. The malleus is attached to the tympanic
yeah.
membrane.
Yeah, like the boxers get it.
Now, what is the only cranial nerve? Don't say anything. Don't say anything. I'm thinking Wendy knows this answer. What is the only cranial nerve that originates from the root of the dorsal aspect of the brainstem? Give me its proper name. The trochlear. Okay. Now, let me say something, all right? This
No,
is
I want to know.
We're gonna get.
I knew it was coming.
Well, that's-
Do you think that we ask you to learn too much in A&P?
Yes.
How
No.
many people say yes? I'm very curious. Okay.
Well, I guess for me, because I've been out of school for like 10 years.
Right. So it's hard for you to learn it. Okay.
Why do you say yes?
Because that's her
Told them
opinion.
mine.
Well, then what you're saying is it's difficult for you to learn it.
Huh?
You're saying it's because you've been out of school for a long time, you're having difficulty learning it.
I'm sorry?
No, it's not.
Everybody calm down.
But that's really a different question. That's really, you're saying that, is it difficult to learn all of it? And I would say, yes, you're probably right,
Yeah.
particularly if you're not. But are we asking too much that you learn all this? You really think that?
I don't
Well, here's what I would say is that,
Do you feel
Mine.
swayed?
no, here's what I would say is that to really be able to care for someone and understand what you're doing, anatomy is the basis for everything in medicine.
Yeah.
And so what you would find is that if you really don't understand anatomy, you're not going to really understand pharmacology. And you're really not going to understand pathophysiology. And so if we dumb it down any more than we already are doing, okay, then we're getting down to this is the eyeball, this is the nose, this is the mouth. If you dumb it down way too much, then almost anybody can become a nurse. Almost anybody can then, follow the order and just do it without understanding anything. And we have nurses who are like that, I granted. But that's not what patients want. That's not what the medical field wants. It wants people who know things. Patients, if you would ask patients, do they want the nurse who finished last in the class? No. They're just hoping and praying that the nurse they have is bright, was at the top of the class. Their goal is not, when you're a patient in the hospital, you want the dumb nurse, the stupid nurse. You don't want it for your parent, you don't want it for your grandparent, you don't want it for your kid. You're hoping that the nurse you have is bright. Because if they're bright, they're going to know what to do. They're not going to make mistakes. You don't want the nurse that makes mistakes. You'll be the first one that's on the phone to the supervisor or that complains to the doctor. Okay? So why would you want to become that nurse that you're complaining about? The only way to prevent becoming that nurse is then to learn things. Okay? This is nowhere near the level that you would have to learn anatomy and physiology if you were getting a graduate degree. Okay? This is nowhere near that level. We're talking about the very, very basics here. We can't dumb it down anymore. Okay? And so, yes, it's hard. I understand that. It's probably, if you've been out of school for a while, you're not used to learning things. Okay? You're not used to studying. Maybe you don't have good study habits. But at some point along the line, you've got to grasp it. Okay? Because ultimately, you want to become a good nurse. You want to be what patients want. You want to meet those expectations. You don't want to be the last person in the class. The person who gets by, that C equals RN person. And so for some of you, it may take taking this course a second time. Okay, I understand that. But in the end, what I'd like to see is that you take responsibility. We joke in the faculty lounge that, students, if they do well, they're all happy and they post on Facebook their scores or their transcripts. Look what I did, look what I did, look what I did. On the other hand, if they get an F or a D, what do they post? Oh, that teacher was too hard. There was something wrong with the teacher. And we all see it. We all hear it. Take responsibility. The way to get better is to own up. Is to say, okay, I need to put more effort in next time. Because ultimately, you could go to, it doesn't matter even what high school you went to, you could go to a school like West Jefferson, let's say, that may not be considered a very good school, but if you do everything you're supposed to, if you read the book, if you do your due diligence, you can still do well.